Julie Alsybrook used to work full-time for Rolls-Royce in Derby and was a carer for her mother. But after catching coronavirus in May, she took redundancy. 4 months later, she says she's still struggling with ongoing symptoms.
You never know when you wake up in the morning how you're going to feel. Sometimes I can feel okay, and other times I get the awful nausea and almost like travel sickness. And so that makes life really difficult, and I know that just not to do a lot, and I just have to do what's important. I try and do things, and then I start feeling really breathless, and you don't do anything. It makes you really, really scared. And sometimes if I'm lying awake at night and I've got like heart palpitations, that really does worry me. And I just think, keep breathing and get through another day.
She's not the only one. Claire used to be fit and active, but now relies on a wheelchair.
I still have heart palpitations, chest pain. I have, as you can see, I'm having to use a wheelchair because my muscles are tensed up with what feels like lactic acid, like you've cycled your bike up a big hill. And I used to ride my bike 13 miles on my commute to work, so it's been completely life-changing in that respect. I hope I will recover one day, but it's been nearly 7 months so far, and I don't know if I will recover or how fully I'll recover. I used to be out and about all the time. I was really active. I was always be going out to the park with friends, really active social life, always out.
Neither Julie or Claire were hospitalised with the infection, but are among thousands of people who say they have long COVID. That's when symptoms persist weeks after catching the virus. There are a number of support groups for people with long COVID on Facebook. One of the groups has more than 25,000 members. Symptoms being reported on here vary from breathlessness, migraine, joint pain, but the most common is chronic fatigue. Most people recover from the virus within 2 weeks, but figures from the COVID symptom app found that 15% showed symptoms for up to 4 weeks. 5% up to 8 weeks and 2% up to 12 weeks. New guidelines are being prepared for GPs to support people with long COVID, and £10 million is being invested into long COVID clinics in England. Meanwhile, the University Hospital Trust in Leicester is investigating the impact of long COVID on people who were treated in hospital.
We've started to do some of the scanning already, and the scanning does show that in some of the organs, so looking at the brain, the heart, the kidneys and the lungs, that there are changes on the scans which could be consistent with damage to those organs, but also could be part of the repair process that's occurring as a consequence of response to COVID-19 infection. So although we're seeing changes in the same way as we're seeing persistent symptoms, it's too early to really then be able to know whether that are important changes that are going to lead to chronic disease.
Claire says people need to be made aware that long COVID can affect anyone.
There are people in my group who are marathon runners, triathletes, competitive rowers, elite athletes who could not have been healthier before falling ill and now have been unable to work for months or unable to leave the house. And I think the general public isn't made aware that people of any age can have this life-changing condition, and if they realise they may not be able to work for months, then I think people would be more careful about wearing masks or going into busy, crowded places.
My biggest concern is that I'm not going to get better, that it's going to be like this permanently, and maybe if I do get weak and get an illness, that the virus will come back and strike again.
Julie says she's taking each day at a time and hopes she'll recover and enjoy the best of life again. Balvinder Sidhu, ITV News, Derby.